What pediatric procedures do you perform robotically?
So our main one that most pediatric urologists do are the pyeloplasties. It's kind of our kind of bread and butter. And then we'll also do reimplants. And then some of the other ones we'll do would be like a ureterostomy, where we say for like an ectopic ureter, we'll take the one ureter and plug it into the other one to help treat issues with like obstruction or leakage problems. And then, so those are kind of the more main ones. And then people are doing some more kind of esoteric ones like bladder neck reconstructions or augmentation. So kind of thinking outside the box, trying to expand the role for robots.
Are you using robotic procedures in teenagers only?
No, we're actually doing them in all age groups. So when I was a fellow, we were doing them in infants. So, kids less than a year of age. But yeah, we're doing them on all ages, even 3 months old. One of my partners just did a 3-month-old the other day. Yeah. So, because the technology from the robots have gotten so much better now that the size has shrunk and the actual robot has gotten a lot smaller. So it's made it much easier and less bulky to do the little babies because there's not enough room than when we were first doing them on the first generation robots.
So what prompted you to implement robotic pediatric procedures in your practice?
I think it's something that we've always done. I mean, I learned it when I was a fellow back in 2005, 2006. So I brought that here to Arizona. I think it's just a way of advancing pediatric urology. And then, parents also ask about it too. So they're kind of aware about the role for laparoscopy and minimally invasive surgery, and robots is kind of part of that group there. So they're the ones also pushing for it too.
In your experience, how does robotic surgery differ from open surgery in terms of pain medications, length of hospital stay, and scarring?
Yeah, I mean, I think it's been pretty well described there, but robotics along with laparoscopy do have their advantages in terms of less pain that's needed, definitely shorter hospital stay for some of the procedures like the pyeloplasties. The scarring is much improved. You're talking about little 3 or 4 millimeter incisions versus, kind of the big flank incision that you would have to have if you had a kind of the old way of doing the pyeloplasty. So, I mean, I think in those aspects, it's definitely much better than doing an open procedure.
What kind of pain medication do your pediatric patients typically receive after robotic surgery?
I mean, there's been a big push to try and minimize the use of opioids. And so we will oftentimes just recommend families use like Tylenol or Motrin alternating, which in some studies have shown to be just as effective as using opioids, at least in the pediatric urology population. For the older teenagers, we'll send them home with some hydrocodone, but we'll oftentimes recommend to the families that they try and just use the Tylenol and Motrin regimen, and then use the opioids if they really have to.
What was the learning curve like for adapting to robotic procedures?
I think for most of us younger surgeons who have kind of learned and trained laparoscopy, it wasn't much of a learning curve, to be honest. And in fact, in some instances, it's a little bit easier because the robot helps with some of the more challenging aspects like suturing. There's been literature that have shown that, some say the number is like 40. If you do 40 pyeloplasties, you have kind of mastered that technique. And so people have actually looked at quantifying how many cases does it take to really be proficient. But I think just like in any other surgery, the more that you do, the more adept you'll be at it. But I think for us younger surgeons, it was an easy transition to go from laparoscopy to robotics.
Is there anything else that you think our audience should know about the robotic procedures in pediatric patients?
Just to know that it's available for the pediatric population, even in the smaller age kids, and there are advantages, again, even in the smaller age kids of doing it robotically versus kind of a more open approach.
Could you give me a sense of the current status of your practice?
Yeah, so when the COVID thing hit here in Arizona, it drastically changed how we saw patients and the number of patients that we're seeing. We had to make a pretty quick transition over to telemedicine. I think PCH did a really great job of doing that, so that we were still able to kind of see and help patients, but yet minimize the face-to-face interaction that we had to do. And so the hospital got everyone involved with Zoom telemedicine, came up with dashboards to help patients get in, and we were able to kind of see wherever they were in the process. And so it's been a pretty nice transition. I'm hoping that we're able to keep that moving forward once everything has lifted. But where we are currently is that now the hospital has opened clinics back up to having them come back into the office. Initially started with new patients, and then I think starting in early June, almost everyone is going to be back in the office. And then obviously with the kind of the safe precautions and the social distancing and stuff like that, but at least then, being able to get them back in the office.
And in terms of your status at the moment, are you providing all the types of care you would have otherwise? Have you had to put surgeries on hold? What certain elective procedures or?
Yeah. Once the governor here kind of limited surgeries to just urgent and kind of emergent surgeries, all of our elective surgeries got put on hold. And so, most of the surgeries at least for pediatric urology are elective. The ones that we still had to do are like the symptomatic stone patients, kids who came in with like testicular torsions or trauma. Those stuff we still had to do, but pretty much everything else was put on hold. And then just recently, over the past week or two, the hospital has reopened up their outpatient surgeries, elective surgeries, just to try and catch up with all the backlog that everyone has had to kind of put on hold for.
Were you doing a lot of telemedicine prior to the pandemic and the shutdown, or has this been kind of a big transition for you personally for your practice?
It's been a huge transition. I was always kind of not necessarily an advocate for it because you're missing that kind of face-to-face interaction, kind of laying your hands on people. And then this has kind of shown me that for some instances, and actually a lot of instances, you get just the same amount as information. And it's very helpful for the families, because Arizona, here in Phoenix, we have such a large draw area. I mean, we get families from hours and hours away. And so I hopefully can see this moving forward, helping those patients.
Have you been drafted at all into, helping care for patients with COVID-19 during this time?
Fortunately, not here in Phoenix. We haven't had as many patients as say like New York with it. Obviously, that's something that we had thought and talked about, but I mean, I think the resources that have been put in place here are good enough, and we've been fortunate enough not to have to be at that level yet.
And in terms of yourself, how concerned have you been about the safety of your family, and what precautions have you been taking to protect them and yourself during this time, being a healthcare provider?
Yeah, we wear masks in the office. We wash our hands frequently. Just from a personal standpoint, my wife has been pretty paranoid about the whole thing. I mean, she understands, it's our job, but when I get home, I have to go in through a separate entrance in the house. I don't get to see anybody. I go and shower and change, and then that's when I then get to see the family. So she's been as expected, cautious about the whole thing, and fortunately everything's been okay here.